If you've ever gone to stand up from your couch or a dining chair, and your body just didn't cooperate, legs shaking, hands grabbing the armrest, maybe even a little rock back and forth before you finally get up, this video is about to explain exactly why that's happening. It's not weakness, it's not just getting old. It's a specific fixable movement pattern, and this video is going to break down the real cause, plus 2 simple exercises used in physical therapy to fix it starting today. Think about the last time this happened. Maybe you were at a restaurant and had to use the table to push yourself up. Maybe you tried to get out of the car and it took 2 attempts. Maybe someone even offered you a hand and it stung a little, because a few years ago, this was never a problem. If any of that sounds familiar, keep watching, because by the end of this video, you'll understand exactly what's happening in your body and what to do about it. Here's the part almost nobody explains properly. Getting up from a chair isn't really a leg strength move. It's a balance and momentum move. To stand up, your body has to shift its weight forward, over your feet, before your legs even start pushing. Researchers who study this movement describe it in phases, flexion, momentum transfer, and extension. And studies comparing older adults with and without functional limitations consistently find that the forward weight shift phase is where the biggest differences show up. When people get older, 3 things usually go wrong at the same time. 1. Weaker leg and hip muscles, especially the quadriceps and glutes, which do most of the pushing work to stand up. Muscle mass naturally declines with age if it isn't actively used, a process commonly called sarcopenia. And it's a key reason strength training is recommended for older adults. 2. Poor forward weight shift. Many older adults try to stand up straight, pushing upward before leaning forward. This fights gravity instead of using it, which is part of why the movement feels so much harder than it should. 3. Reduced core and ankle stability, which can make forward leaning feel unsafe, so the body instinctively leans back instead. The opposite of what's needed to stand up easily. This combination is exactly why so many people over 60 end up relying on their hands, the armrests, or a nearby table just to get up, which is also why clinicians use a 30-second chair stand test as a simple way to check lower body strength and fall risk in older adults. The good news? This can be retrained. It's not about getting old. It's about relearning the movement pattern and rebuilding the specific muscles involved. So, today, 2 simple chair-based exercises will be shown. The first is a strengthening exercise recommended by the CDC's Fall Prevention Program, and the second is a technique cue commonly used in physical therapy to correct how the movement is done, not just build strength. No equipment needed, and both can be done at home right now. Exercise 1. The chair rise, sit to stand. This exercise is directly recommended by the CDC's Steady Fall Prevention Program to strengthen the thighs and glutes and reduce fall risk. Setup. Sit near the front edge of a firm, sturdy chair. Avoid soft couches for this one. Feet placed slightly underneath the chair, hip width apart. If standing feels difficult, place a firm cushion on the seat to raise the height slightly. Steps. 1. Scoot the hips forward until sitting near the edge of the chair, with feet placed directly underneath the knees. 2. Lean the upper body forward so the nose moves out over the toes. 3. Push through the legs, and if needed, through the chair's armrests to rise to standing. 4. Slowly lower back down with control and repeat. Start with 5 to 8 repetitions, once or twice a day, and build up gradually. The long-term goal, per the CDC's own guidance, is to eventually do this without using your hands at all, since that's a sign the target muscles are getting stronger. Exercise 2. The forward lean technique, nose over toes. This second exercise isn't a separate clinical exercise with its own name in the research. It's a technique cue physical therapists commonly use to correct the tendency to lean back instead of forward when rising from a chair. Think of it as the form fix for exercise 1. Understand the problem first. Many people's weight sits in the middle of the body or even slightly behind it when trying to stand. To rise easily, that weight needs to move slightly ahead of the body first. That forward momentum is what makes standing up feel almost effortless. And it's the exact phase researchers have found is most affected by aging. Step 1. Starting position. Sit at the edge of the chair, feet flat on the floor, hands resting on the lap, not on the armrests. This helps the body learn to use its own weight and momentum, rather than relying on the arms. Step 2. The lean. Lean forward slowly until the nose travels just past the toes. This shifts the body's weight forward and creates the momentum needed to rise. Step 3. The rise. Once that forward lean happens, push up through the heels and stand. It will feel noticeably easier than trying to stand straight up from a still position. Step 4. The controlled descent. When sitting back down, go slowly. Aim for about 4 seconds to reach the seat. Slower, controlled lowering asks more of the leg muscles than simply dropping back into the chair. Step 5. Reset and repeat. Once seated, pause for a moment, then repeat the same sequence for several repetitions to let the body learn the pattern. Modification for extra safety. If leaning forward feels unstable, place another sturdy chair or stable surface directly in front, and rest both hands lightly on it while practicing the forward lean motion. This provides support while still training the correct pattern. A helpful cue to remember: the hips should bend, not the back. The back stays fairly straight, while the hips fold. This is the safest and most efficient way to rise from a seated position. A few important notes before trying these. If there's any sharp pain, dizziness, or a feeling of instability while attempting these movements, stop immediately and don't push through it. Anyone with a recent hip or knee surgery, a diagnosed balance disorder, or a history of falls should check with their doctor or physical therapist before starting any new exercise routine. Always have a stable surface or another chair nearby when practicing this for the first few times. Progress slowly. The goal is consistency, not speed. These exercises are based on published fall prevention guidance from the CDC's STEADY program and general physical therapy movement principles, but they are not a replacement for personalized medical advice. Anyone with ongoing pain or mobility concerns should consult their physician or a licensed physical therapist. If getting up from a chair has felt harder lately, try just the forward lean technique the next few times, even without the full chair rise exercise, and notice the difference. Small, consistent practice is what rebuilds this pattern over time. This channel exists to explain the why behind the health changes that come with age, not just tell people to manage it, but actually show what's happening in the body and what can be done about it. If this video helped make sense of something that's been frustrating, hit like so more people over 60 can find it, subscribe for more videos like this every week, and drop a comment below: has this happened before? And did the forward lean technique feel different? Let us know. See you in the next one.